Hey guys, Dr. Davin, board certified laser dermatologist. Look, I realised what's been missing from this channel. I've always been talking about high-end treatments like, things like thermage, laser therapy, how to get your pores cleaned or pores smaller using high-end laser devices. And I have forgotten the most important aspect, and that's basically, look, if you want to pick up a really cheap, simple, easy but cost-effective pickup, what is the treatment of choice? Is it going to be a laser treatment? Is it going to be a chemical peel? Is it going to be something like our Clear and Brilliant over here? No, it's not. I think that having it's important for everyone because it's a budgetary constraint as well. So basically, you want to have good skin, give yourself a pickup, and I believe that the treatment of choice is this. It's called a HydraFacial. So what's a HydraFacial? I'll explain shortly. It's basically different from a microdermabrasion. Why? Because a microdermabrasion basically uses crystals in a high-powered setting to remove dead skin cells, the upper layers of the skin, and then extract it out. So that's what a microdermabrasion does. Do you get good results from it? Yes. Do you get better results from this? Absolutely. So this is called HydraFacial. HydraFacial differs because it not only extracts dead skin cells, but it infuses. So at the same time of extraction, we're basically removing dead skin cells, but we're infusing the skin with active ingredients. And we can concentrate it using different ingredients, including vitamin A's, vitamin E's, antioxidants, and even HA, so hyaluronic acid. So for a cost-effective, in other words, a cheaper pickup, where you're feeling, hey, my skin's looking a little bit dull, I don't want downtime, I don't want to actually go out there and have a laser. What do I like? This. So I personally don't use this much, and I'll tell you why. It's because it takes about 30 minutes. I've had it done. If I have that 30 minutes spare, sure, it's nice and relaxing, but most of our dermatologists absolutely love this. So I'll show you how it's done very shortly and walk you through it. Thanks for that. Cool. Hey guys, so we've got
Sophie.
Sophie's here for a quick pickup in regards to your skin, yeah?
Yeah.
So what bothers you in regards to things?
At the moment, just like lots of congestion, especially wearing makeup daily for work and things like that. So just want to clear that out and get my skin back into top shape.
Cool. Cool. So what we're going to do is exactly what she says. So we're going to be concentrating on clearing up your skin. Mm-hmm. So with this HydraFacial, we can use different, settings. Yeah. And the setting we're going to use, I think you'll do well with the BHA, which is the beta-hydroxyacid or salicylic acid. Perfect. That's the same stuff you use to exfoliate, but we actually build it in and we actually infuse that in you. So we're going to look at extractions, and then infusion more of the BHA. I think less of the HA, but more of the BHA. Guys, we'll see how it's done in Sophie's case. So looking forward to it?
I'm so excited.
Okay,
Thank
cool.
you.
No worries. Kayla, what are we using to cleanse?
We're using the HydraFacial MD Active Cleanser.
Okay, cool. That gets rid of the makeup and a lot of debris and hopefully some sebum as well, yeah?
Yeah, that's
cool. So that's a really quick process. It's nothing harsh. We're basically removing makeup and just preparing the skin for the actual HydraFacial itself. So that takes about a minute to do. And here we go to the second phase. Okay, so now Kayla's doing a specialized treatment with this. So what we're going to do is we're going to increase the vacuum control. The reason being in this skin type where we want to actually extract as much sebum and dead skin cells as possible for congested skin, the first mode of vortex cleaning and exfoliation, we basically want to go up that little bit more compared to a normal patient because the whole idea in this situation is to clear up her skin and remove the blackheads and congestion. So we're using it in vortex mode. So guys, this is the way we perform it. So that is a vortex suction. In this setting, what it's doing is exactly as it suggests. It's using a vortex generator to suck away the dead skin cells and exfoliate the skin. So it's nice and gentle. Hey, how are you feeling?
I feel great. Yeah, it's awesome.
Yeah. No pain?
Nope, no pain.
Yeah. So unlike microdermabrasion, where it can be a little bit uncomfortable, this feels totally different. It's basically just suction, isn't it? Yeah?
Absolutely, yeah.
Yeah. Remember guys, we can control that using the screen out there as to how much vacuum control we want. So step 1, we'll go through step 2 very shortly. So we're doing a second pass. This is Kayla's second pass. We've concentrated. The great thing with this is we can concentrate on certain areas as well. So we know in the acne-prone patients, the T-zone is certainly an area that needs to be concentrated on. So we can concentrate a lot of vacuum on the nose and the forehead area, together with the chin and cheek area as well, to exfoliate the blackheads and decongest the skin. So, pretty cool. Guys, now we are part 2. Part 2 is basically the acid peel. So it's a 7% glycolic acid, 7.5% glycolic acid, and a 2% salicylic acid. So this is part 2, which is basically the acid peel. So we are peeling at the moment. So remember guys, we're not only vacuum extracting, but we're peeling using both the glycolic acid and the salicylic acid at the same time. Once again, we're concentrating on that T-zone area there. You can see she's going around the nose. And with this solution of both the glycolic acid together with the salicylic acid, what we're doing is we're loosening up the clogged pores. So this stays on for a few minutes. So once the pores are loosened up, we will go to step 3. So for all you popaholics and extraction guys, sorry, you're not going to see any extractions here. It's just vacuum extractions. Okay guys, so this is step 3. So we've just turned the vacuum control up to 28. In fact, I might even see whether I can go to 29. Because she's got very young skin, and basically what we're doing is we're extracting. So this is vortex extractions after the glycolic and salicylic acid to loosen up the pores. How's everything going? Is it stinging or painful at all?
No, it feels absolutely fine. I can definitely feel it like sucking though, which is good. So
cool. So this is step 3 guys. So basically what we're doing, or what we've done, is that we have loosened up the keratinocytes, or loosened up basically the keratin or the dead skin cells within the clogged pores using the glycolic and salicylic acid. And right now what we're doing is we're using a super strong vacuum, but it doesn't hurt, does it?
no, can't. It's very it's really good.
It's really cool?
Yeah.
Cool.
Loving it.
So it doesn't hurt. It's not like blasting away with sand crystals or diamond crystals or microneedling. It's a suction device, and what we're doing is, once again, we're concentrating on the T-zone to get out all those debris and clear out the acne-prone areas. Okay, guys, so we are now in mode 4, which is basically the vortex infusion. I'm going to turn this vacuum control up just that tiny little bit to 19. Just some fine adjustments. And what we're infusing is we're infusing antioxidants. So the antioxidants we're using for this is vitamin E, but also we do have some plant extracts as antioxidants. Most importantly, in this situation, we've got vitamin A, which is being infused. And as all you guys know, vitamin A is a retinoid or retinoic acid. In this situation, the infusion will help decrease acne-prone areas. So basically, it helps decrease acne, decrease blackheads, decrease whiteheads. So the infusion in this situation is very important. We're also infusing hyaluronic acid, or HAs, so it'll plump up the skin at the same time, and that can help reduce the appearance of acne scars for up to 28 days. So I won't say it's a permanent reduction because we cannot get the HA through into the dermis, but it can certainly help with minor acne scarring. How's that feel after that?
Yeah, it feels really good. Super relaxing.
Super relaxing, cool. Okay guys, so that's step 4. And what does it say here? It says continue at home. So I guess we've finished the procedure. So there you have it guys. HydraFacial wrapped up in a few minutes. So what we do now is we get the patients to actually use a topical, and so basically a cream, just a protecting cream, protecting serum. And hey, Taylor, what's in the serum?
Advanced antioxidants, peptides, and hyaluronic acid.
Cool. So we're basically infusing more HAs, more peptides. And as you know, copper peptides and all can work with skin rejuvenation. And antioxidants such as vitamin C, vitamin E, plant extracts can help decrease free radicals, which can reduce wrinkles.
So we're just going to leave that for 10 to 15 seconds. If it's dry, then we're going to pop another layer on, and if not, we'll just pop the moisturizer on.
Okay, so the final steps of moisturizer, and that's it, guys.
Yeah.
Okay, guys, so there you have it. That's HydraFacial for you. Realistically, the prices range from anywhere between 150 to 250 depending on where you go. It's a very affordable treatment. I've always been using or showing you guys high-end things which we do, you know, laser resurfacing of the eyes and fillers and all. But look, for a quick pick-me-up that's going to actually rejuvenate your skin and give you that glow, I do believe, bang for buck, that HydraFacial is the way to go. I think microdermabrasion is outdated now, now that we have devices like this which both extract but also extract gently. And you can see with the extraction we can turn down, up or down the volume with the extraction, so they can all be bespoke or individualized, and you can also see the amount of things we can infuse in the skin as well. So I think that this is the next level when it comes to microdermabrasion, and certainly does it have a place in what we do as cosmetic and aesthetic dermatologists? Absolutely, because entry-level treatments like this can make all that difference. Guys, thanks very much for watching this video. I hope I've helped you in regards to education. I do one video every Saturday morning, Brisbane time, that's Brisbane Australia time. So if you like, subscribe, and I'll see you next Saturday. Thanks guys, bye. For those of you watching this video for the first time, my name's Davin Lim, a board certified laser dermatologist. I do one educational video, so all my videos are educational, a little bit of fun here and there, but on dermatology and all aspects of skincare. So I'm on Instagram and I do post a few videos a week as well. So if you're really bored, follow me on Instagram as well. Thanks. Bye guys.